The Canadian Task Force lumped women who have dense breasts in with average risk women. Now, dense breasts are normal and common, and 40% of women over the age of 40 have dense breasts. What that means is that they have more normal breast tissue than fat in their breasts. All women have breast tissue, sometimes called fibroglandular tissue, and fat in their breasts. But the proportion is what's important. If there's more fat than normal breast tissue, we say the breasts are not dense. But if there's more normal breast tissue than fat, then the breasts are dense. And there are two risks to having dense breast tissue. The most important is that when a woman has dense breasts, her mammogram won't be as accurate. She could have a negative mammogram even though she has cancer. Mammograms actually miss about 50% of the cancers in women with the densest breasts. So a mammogram report saying negative doesn't mean that she doesn't have cancer. Another important risk of having dense breasts is that having dense breasts is an independent risk factor for getting breast cancer. In other words, women who have dense breasts are at a higher risk of getting breast cancer than women who don't have dense breasts. And most women don't even know if they have dense breasts. Women should be asking after their mammogram if they have dense breasts. And that's because if you find out that you have dense breasts, at the very least, you should be doing regular breast self-examination. Now, the task force said that women don't need to do breast self-exams. But in fact, that's how women find their cancers when they're missed on their mammograms. All women should do breast self-examination. Get to know what your normal breast texture feels like. And if you feel something different than normal, you get it checked by the doctor. Sometimes it's something that can come and go with your period. Always do your breast exam after your period. But if you find something different and it stays there, go to the doctor. You may need a mammogram. You may need an ultrasound. Ultrasound can find cancers that are missed on mammograms. And when a woman knows that she has dense breasts, some women are able to get ultrasound in addition to their mammogram as a screening test. We know that when women have dense breasts and they have both mammograms and ultrasounds, we can double the cancer detection rate. And ultrasound helps us find cancers when they're still small and they haven't yet spread to the lymph nodes, so they're more curable. If a woman has dense breasts and she has cancer and doesn't find out about it and doesn't do anything about it, that cancer will grow. And when a cancer grows to the point that it can become feelable, sometimes that's when a woman will feel the lump and go to her doctor and be diagnosed. We call those cancers interval cancers because they're diagnosed in the interval between planned screening mammograms. And interval cancers tend to be larger, more often high grade, meaning aggressive. They're more often spread to the lymph nodes than smaller cancers. And women with interval cancer don't have as good a prognosis or an outlook as women who have cancers detected at screening.